Good evening. We begin tonight with a developing story. Waterloo Region has its first case of measles since 2019. Public Health says it is related to that ongoing outbreak that we've been telling you about across southwestern Ontario. CTV's Krista Simpson following the latest developments on this tonight, joining us with more. Well, Krista, Public Health says, they were expecting this and that they prepared for it.
Tony, the outbreak in southwestern Ontario began in October and has now spread to areas covered by numerous public health units. Region of Waterloo Public Health says with so many cases in neighboring areas, they knew it was just a matter of time before there was a confirmed case here. And while they cannot provide many details about that case, they say it isn't a person who was not fully immunized against the virus. Public Health says they are doing contact tracing. They're also warning that anyone who was at 51 Benton Street in Kitchener, a building with a number of medical clinics in it, on Tuesday between 4:15 in the afternoon and 7:15 in the evening, could have been exposed to measles.
Of the way measles is transmitted, because the virus particles do become airborne and can be transmitted to the air, we do have to consider the entire location as a site of the exposure if a case was present there in their infectious period. And so what we are recommending is if anyone was in that location during those times and on that date, then they may have been exposed, and for them to contact public health, and then we can do a further assessment as to their susceptibility and any need for post-exposure treatments. In general, people who are fully vaccinated against measles would not be considered at risk, even if they were present in the building.
Public Health is particularly warning anyone who is at that 51 Benton Street location during the date and time listed and is immunocompromised, pregnant, or born in or after 1970 and hasn't had the 2 doses of the measles vaccine. They say anyone in any of those categories should reach out to Public Health immediately. Now, the outbreak in Ontario began back in mid-October, and according to the latest numbers from Public Health Ontario, which tallied up known cases up until Wednesday, there are 470 cases associated with the outbreak so far. Of those, 120 are new cases identified just between last Friday and Wednesday. Dr. Bana says Public Health is anticipating there will be more cases in Waterloo Region.
I absolutely think this is the first of many cases, most likely, given the trajectory of the provincial outbreak, as well as how impressively transmissible measles is as a disease. So we do expect to see increasing cases and increasing exposures over the next weeks and months, and we'll continue to keep the public updated.
Of the 470 measles cases in southwestern Ontario, 34 people have been hospitalized and 2 needed intensive care. Dr. Bana reiterates that the best protection against measles is vaccination. In Ontario, most children get their first dose at age 1. In some areas where there are more measles cases, they are offering it sooner right now, between 6 months and 11 months. But at this time, Waterloo Region is sticking to the typical vaccination schedule for most children: 1 dose at age 1 and that second dose between age 4 and 6.